So we're all looking to improve outcomes in mantle cell lymphoma, particularly in a subgroup of patients with a TP53 mutation. We know from historical data that these patients have a very poor survival with standard immunochemotherapy. Probably our best frontline immunochemotherapy results in a progression-free survival of under a year and a median overall survival of only about a year and a half. So we really must do better in this subgroup of patients. And we're starting to understand this group better, and we're starting to realize that novel agents may well impact this patient population. So Anita Kumar from Memorial Sloan Kettering is presenting very exciting data on the BOVen regime, so it's Zanubrutinib, Venetoclax, and Obinutuzumab, studied in a multi-center phase 2 study of patients who are treatment naive, so the frontline setting, with a TP53 mutation with mantle cell lymphoma who otherwise require therapy. And we've seen some small data sets from this study before. Here we see 25 patients, data on 25 patients, median follow-up of 16 months, and really very high response rates, including very deep responses. So the best overall response rate, 95%, and a CR rate of 88%, which is really unprecedented in this cohort of patients that we know historically do very poorly with chemotherapy, as I mentioned. The one-year progression-free survival rate looks good at 84%, excellent compared to historical chemotherapy data. And one of the other nice things about this therapy is it's MRD-directed, again, in terms of its length of therapy. So, potentially these patients can have a sort of individualized approach based on the depth of their response. The combination looks to be well tolerated. We're obviously now increasingly used to doublets and triplets in CLL and mantle cell lymphoma and other disorders, and understand that BCL2 BTK combinations require monitoring for some GI and neutropenia related toxicities, sometimes effective toxicities. But on the whole, in this patient population, the treatment was very well tolerated. So this is extremely exciting data. It certainly shows, in my mind, the direction of travel in mantle cell lymphoma, particularly in patients with very high risk genomic features. And so again, I look forward to this data being presented at the ASH Congress.